Welcome back to DotLife. We are here on location today at BostonX in Adams Village at the Med Spa, which is owned by Nicole Flaherty. Nicole, thanks so much for hosting us today.
Thank you so much for allowing us to have you here.
Absolutely. And we're also joined by Carrie Dougherty, who is the nurse manager here.
Hi, how are you?
Great. Thank you for coming, Carrie.
Oh, thank you.
So I want to talk a little bit about the med spa and the cosmetic industry in general, but before we get into that, tell us a little bit about yourselves. You're both Dorchester residents, and about the business and how this came to be. So Nicole, I'll start with you.
Yeah, great. So I am a nurse practitioner. I worked in the hospital at Beth Israel downtown for almost 20 years. And I was doing Botox on the side, just kind of like private parties, that sort of thing, getting a lot of really great feedback, and then going into the hospital, and that's definitely a hard place to be at times, especially because I was in the ICU. And I thought maybe I want to kind of pivot a little bit. I turned 40, and I was like, let's do something a little bit different and do something I really enjoy.
I think when you turn 40, if you aren't thinking that way, you're doing it wrong. Like, it's time to be happy.
Yes, exactly. I put the time in, and no. So it was a little bit of a change, actually a huge change, but really, really excited that I did it and really enjoying doing this for the people in our community.
I can't imagine the shift in hours must be completely different.
Absolutely. So as a nurse practitioner, we are considered providers in the hospital, and I was doing 24-hour shifts, and now I'm doing whatever works for me and my family. So that's amazing.
Good for you. That's awesome. And Carrie, how about you?
I worked at a med spa on the other side of Boston and in Somerville for a few years. It was a bigger company, so I always wanted to work with like a small business type vibe. And then we met through mutuals. My neighbor and her husband were friends growing up, and so we made a connection and had some lunch at Lucy's, and now we're here.
The rest is history.
Yeah.
And you are officially OFD.
I am OFD, yes.
Very nice. And Nicole, you're just...
Husband is OFD, so obviously I had no choice.
So you're not even DBC. You're Dorchester, not by choice. But
No, definitely by choice. This is the best place to raise a family.
Awesome.
So, yeah.
So you found this space. It was empty when you found it.
Yep.
And we're right next to Blasi's, for those who are kind of familiar with the area. And Blasi's had a fire a few years back, and this space was part of that fire.
That's correct, yeah.
So how much did go into the reno?
Yeah, so this place was down to the studs, but I mean, so that's kind of a big undertaking, but I looked at it like, we're gonna make this exactly what I want it to be in every way. So we hired an amazing contractor, PJ Kelly. I would recommend him to anyone. And I got an amazing interior designer, Justine Spalding Spitz, and we took this place on. It took about 5 months, and we opened May of last year.
So you're at just over a year. Congrats.
Yeah, thank you.
That's
thank
wonderful.
You so much.
So I want to pivot a little and talk about the industry in general. So there's a lot of folks who do have cosmetic procedures, or is cosmetic procedures the right term?
I think it's kind of an umbrella of what we offer, yeah.
There's a lot of people who don't, or don't know much about it. So let's talk about what it is, what it isn't, what types of services you offer here, and kind of where people should be thinking about what might work for them.
Yeah, so we offer neurotoxins, which everybody calls Botox. It's like calling it Band-Aid. It has the brand name, and that helps with some anti-aging effects. It can help like reduce wrinkles in the upper face mainly. We also do fillers, which is a hyaluronic acid that you inject into the most common place is the lips. Some people will do it in their cheeks, their chin, anywhere where volume loss is noticed. We also do medical weight loss. We carry semaglutide, which is all through Nicole because she is a nurse practitioner. And then we do IV hydration. A lot of people think that it's just for hangovers. We get
It's not.
No, most of our clients that come in for IV hydration come in for like health maintenance. They come in every couple of weeks for an IV. Some people will come in before a race. We had over 40 people come in before the marathon. And then some people come in for our immune mix if they're sick. It's all different. And we also do consultations. So many people come in and say, I don't know what I need. I know I want something. And then we'll talk to them for 15, 20 minutes and kind of make a plan together.
And consultations are always complimentary.
What are the trends right now? You've talked a little bit about kind of the procedures, but what are things, I know that like minimally invasive is definitely kind of trending. I think that's always trending, right? Like nobody wants invasive. But also like more natural looking results are really in.
Absolutely. Yeah. We like to say at BostonX, we like inject the undetectable injectable, because we hear all the time during our consultations, I don't want to look different.
Yeah.
And that's the main goal. We're just going to make you look like you slept well last night, basically. Look like yourself possibly 5 to 10 years ago. So.
What are some misperceptions that you think people have about Botox or fillers, and how would you debunk those?
Yeah.
Probably that you're going to look plastic.
Yeah, for sure.
It's really hard to do that much in like one appointment and make you look completely different. People also clump Botox and filler together.
Yeah.
So
I think it's the same thing. Yeah.
Okay.
Yeah, a lot of people think that when you do Botox, you're then going to have these huge lips, and they're not even related at all.
Yeah.
And people mention saying, I don't want to look like that actress that overdid it and can't reverse it now. But we really go for the natural look. I have filler everywhere and I have Botox everywhere, and so many people tell me they had no idea, and that's my goal.
Right.
My favorite is when somebody says that their partner didn't even notice. So it's like, it's more for you.
Yeah.
I got like a little bit of my lips done, and my dad was like, I don't mean to offend you, but I can't tell. And I was like, that's amazing, because I can tell.
Yeah.
It helps with my confidence. I look in the mirror and I feel better, but people around me aren't noticing that huge change.
Yeah,
So fillers and Botox, I believe both are short term, right? They're not a permanent change. Fillers dissolve over time. Is that right?
That's correct. Your body naturally metabolizes them over time.
Okay.
Or rarely, if like fillers go to a place that they shouldn't, if injected improperly, we're able to dissolve them with the medication. Yeah.
And Botox has a time.
Yeah, it's usually about 3 to 4 months at last. Yeah.
So even if someone were to hypothetically do this and hate it, it's not like you're stuck with it forever.
Exactly. I actually love to inject first-time Botox users because I'm like, it's not forever. But you're going to love it, and I'll see you back in 3 to 4 months. And we always go super slow and light for those particular clients, and we have them come back at 2 weeks so they usually need more, but just so they're not like diving in deep.
Yeah.
We go nice and slow.
And what about the health risks? Are there health risks associated with, it's called toxin, so.
Yeah. That's a really good question.
It's definitely, people have like a negative connotation with that word for sure. There isn't too many like long-term health effects. It's all about who is injecting it, making sure that you have an actual medical provider, not just an esthetician, and getting the right product for you. People could maybe get a little bit of like the eyelid going up like this. That just requires a couple more units here and there. But as long as you're being transparent about your medical history, and we are like licensed, like I said earlier, it really isn't that dangerous.
Botox is also used for migraines, right? Or other non-cosmetic purposes.
That's correct. Yeah, we do a couple of those services here. Typically for migraines, I ask them to go to their provider because insurance will cover it, and it's a lot of units. And so we would rather them get the service for free to treat their migraine. But other places that we inject that are considered like medical procedure are the masseters, for TMJ, for clenching, that sort of thing. We do that quite often. There is a cosmetic benefit to it as well. It does like slim the face. So we have people come in for that reason, and then also for the clenching and kind of relieving the stress in the jaw.
What does it does it relax the muscles or tighten the muscles?
So it relaxes the muscles, and then over time the muscles aren't being used as much in clenching. And so if you think when you like lift something, you're building muscle, so there is atrophy
Okay.
to the muscle of the jaw.
Oh, interesting.
Yeah. And then we also do Botox under the arm for people who have hyperhidrosis, which is
Okay.
excessive sweating. So people who find themselves like not able to wear white shirts, it's perfect for them. And it actually lasts a little bit longer than the face does, about like 6 to 9 months.
Oh, I had no idea that was a use case. That's
yeah.
really cool.
Yeah, it's really cool.
Talk a little bit more about the IVs, because that is
Game changer.
So you mentioned, it's a performance, potentially like athletic performance
Yep.
solution. Also, there are medical IVs, obviously.
Yep.
Do you do medical IVs here?
For sure. So people who suffer from migraines, we get several of those clients as well, because if you were to go to the emergency room, you would get the exact same thing that we offer. Because I'm a nurse practitioner, because we are healthcare providers, I'm able to give medications such as Toradol, which is a high test ibuprofen, so it helps with migraines. People who are pregnant, like in their early pregnancies, we give them IV fluids. We give Zofran, which is an anti-nausea medication. So it's really helping a wide variety of people for many different reasons, not just the hungover person on Saturday morning, which we do get, and we love them. We've all been there. So,
yeah. It's funny. I was actually just talking to a friend of mine the other day, and he said he had had some sort of episode and had to go to the emergency room, and they did admit him, or they were going to admit him. They gave him a full bag, and they said, we can't give you another one for 12 hours, so we're going to admit you, and that would have cost a fortune.
Yeah.
So he ended up leaving and then going to a place like this and got the bag the next day, and it was fine.
Yeah.
For thousands of dollars less.
Yep, exactly.
It's crazy.
Yep.
Such a weird healthcare situation.
Yeah.
Anyway,
Yes,
different podcast topic.
Definitely.
So
I'll tune into that one for sure.
what do other people get IVs for? So it's hydration is one of them, right? Is there any what do you put in the IV? Is it electrolytes?
Yeah, for sure. So you can get a plain bag of just normal saline without anything added. You can get vitamin complex, vitamin C, a mineral blend. We do calcium in there, magnesium, which is really great, especially for the migraines and pain. Women who are on their period or menstrual cycle that get really heavy ones, it does help with that.
Okay.
Like I said, early pregnancy, the women with like hyperemesis gravidum, which is just throwing up constantly, just can't even get out of bed. We have some of those women in here 2 times a week, just helping them get through. And then actually last month, one of them came back to show us her baby, and we're like, we helped with that.
We grew you.
Exactly. And then we had Pan Mass Challenge. Bikers come in before their big race.
Yeah.
Like Carrie mentioned, we have about 45 Boston Marathon runners come in. So and then we have our regulars who come in once a week or once every 2 weeks just for hydration, just like as part of their wellness plan.
And what about the facial? What is it called? A hydrating facial? Is that what you offer?
Hydrofacial, yeah.
Hydrofacial basically deep cleans the skin. It exfoliates. It gets rid of all of the dead skin cells on the top layer of your skin, and it also helps reduce congestion. And that way, whenever you are doing your skincare or putting products on, it's able to penetrate deeper, and you're actually getting more out of it. And then at the end, there is a final hydrating portion where you just push all of the antioxidant hydration into the skin. Nothing is there to block it from getting to those deeper layers. And a lot of the times we'll have patients, they'll do the Beauty Mix IV, which has biotin and vitamin C in it, while getting the hydrofacial. So they're getting hydrated inside and outside.
Do you have a lot of guys come in?
We have some guys, yeah.
And
I mean, definitely more women, but we do have guys, especially that like their Botox.
Okay.
There's that people call it Brotox. But I mean,
there doesn't even need to be a different name for it.
Really and truly. And you know what? Guys like to look good too. And my husband never had Botox, and I was like, you are looking like you need some. So I was like, great.
This will be nice thing for you to say.
This will be great content. So, and now he's like, I'm never going back, because it really doesn't change the way you look. It just smooths the lines and wrinkles.
What's the difference? You're a med spa. What's the difference between a med spa and like a day spa or a non-med spa? Is there any kind of licensure difference, or is it just the services you offer, or is it your qualifications? Like, what makes it different?
Yeah, I definitely can see how there can be confusion because there is some crossover for sure. Because we do offer facials, you don't need to be a medical provider to perform those. However, any of the other services that we offer, the weight loss, the Botox, the fillers, the IVs, you do need to be a medical provider. In order to own a med spa in Massachusetts, you need to be a nurse practitioner or a physician.
Okay.
Yeah. So yeah, there definitely is confusion. I would definitely encourage the listeners to make sure that they're receiving medical services from a medical licensed person.
Yeah.
Is it possible not to? Should you be checking at the spa?
I think you should be interviewing your provider.
Really? Okay.
I mean, we're asking you questions about your health history before we provide any service. I don't think it's unreasonable for you to ask your provider where they went to school, what certification they have, just because of the recent news story that came out. If any of our patients want to see what we're injecting into them, want to look at the bottle, if anyone wants to know where I went to school or look at our licenses,
Yeah,
your 20-year history of
yeah. Like, of course,
Yeah.
you should feel comfortable where you're going, and what products people are giving you.
Yeah.
And it is nice when your patient does ask you these questions because you know that they care. They're putting in a lot of thought into this.
You don't take it as a challenge. You take
Not
it
in the
as
slightest.
No, not at all. I think most of Botox takes about 2 to 5 minutes to inject. It's very, very quick, but we have 25-minute appointments, and that's because we're being thorough with our patients. We're asking them their health history, and then most of the time I'm just providing education about what the product does, what you should expect, and the aftercare.
Yeah.
That's what most of the appointment takes. The actual injections, 2 minutes tops.
Yeah.
Is it painful?
No.
Are you sure?
Okay.
Yeah, see, here we go.
So,
Filler is a little more sore.
Yeah.
Because the needle's in a little longer and there's a bit of pressure.
I would say anything around the lips is
Yeah, I
spicy.
can imagine.
We use the word spicy because that sounds better than
It's
painful.
gonna hurt.
But the forehead, no, those
Yeah.
are little pinpricks, and with filler we numb the area too, so it's a little less spicy. But
Yeah.
you can get Botox in the lip. It's called a lip flip, and it's quick, but it's spicy.
Is it long-term pain or just in the moment?
Just in the moment.
No, it
Okay.
stings for about 5 seconds.
Yeah.
Okay.
And it makes your eyes water.
Yeah.
Because
Or
we have so
sneeze.
many nerve endings on our
Yeah.
lips.
Yeah.
And everything is connected up here. So it makes your eyes water and then you're over it.
I'm not gonna lie, the women have a very high pain tolerance,
100%.
much higher than men.
100%.
Yeah.
For sure.
I think we can handle it.
Yeah.
Let's talk a little bit about the weight loss
Yeah.
services that you're offering. That is clearly a trend. It
Humongous.
has burst onto the scene in the last couple of years.
Yeah.
What do you know about semaglutide, and do you recommend? Obviously, you recommend that you offer it. So why do you recommend it, and to whom, and who should be thinking about it?
Yeah. So I think there's a recent study that about 33% of the population will be on it within the next few
What?
years. Yeah. So
Wow.
I don't think it's going anywhere. I think the more that we learn about it, we're just learning so many more benefits as we go on. When we first opened a year ago, there was a recent study that it decreases the risk of Alzheimer's. Anecdotally, I'm seeing a lot of patients that were on anxiety and depression meds that are coming off of it now. Just to show
There is some crossover, right?
Yes, for sure.
Yeah,
There's
Wellbutrin is part of that whole suite of
Yeah, it's amazing. And so it's just showing that before we had this theory that there was a gut-brain connection, and it's kind of proving that that's the point.
Yeah.
They're showing that shopping addiction is decreasing while being on the med.
Wow.
People who tend to partake in alcoholic beverages are drinking less. So so there's a lot of really cool benefits besides the amazing, losing weight, decreasing cardiovascular risk, that sort of thing.
And this is an injectable.
This is an injectable.
Is it a regular series, or how often do they?
Once a week.
Once a week, okay.
Once a week, yeah.
And for how long? Until you hit the weight you want?
Yeah,
Or?
so we have a wide variety of patients that we see. We have patients that want to lose 200 pounds, and we have patients that want to lose 10 pounds.
Okay.
So I'm in control. I prescribe the medication. So if someone is coming in for their wedding and only wants to lose 10 pounds, all right, well, we won't take it further than that.
Yeah.
Or if someone needs to be on it more long term, then they're able to.
So I thought, at least when it first came out, I thought it was you were only eligible if you had to lose like more than 50 pounds or something, right? Has that changed?
Probably not
Okay.
with your primary care doctor. So we
Got
don't
it.
go
Okay.
through insurance. So
Okay.
so we don't take insurance at all at the
Got
medical
it.
spa. So if you wanted to get it through your physician, typically you have to be a certain BMI
Okay.
and have certain comorbidities in order for your insurance to cover it. That's the nice thing about the med spa because we don't have to go through insurance. So we kind of have our own path.
And where is this semaglutide suite? Beck, I'll be right back. No, I'm just kidding.
I'm like, did I miss something? Yep, it's an amazing drug and it's working
Yeah.
for a lot of people. I mean, people do best when they do it with eating right and exercising.
Yeah,
How-
and the maintenance too, right? Because once
the
you come off
maintenance.
it, you could gain the weight back if you're
You
not.
could gain the weight back. We do drop the dosage.
Okay.
So people can go on maintenance for a few months after they've reached their goal. And studies show that helps reduce the risk of rebounding.
Okay. What's the risk?
It's completely contraindicated if you're pregnant or breastfeeding. It's
Okay.
completely contraindicated if you have a family history of thyroid cancer.
Okay.
And if you have a history of pancreatitis.
Does it increase those risks if you don't, or is it just not compatible?
Yeah, so one of the studies on rodents did not increase the risk of thyroid cancer. However, that has not been proven on humans. So, but we just don't even take the risk. If you have a family
Yeah.
history, we don't prescribe.
Okay, got
Yeah.
it. Talk about costs. These procedures are not inexpensive. So what would you have people think about if they're thinking about getting some of these procedures? How much should they be? What number should they have in their head, or what range? And is it like a monthly cost? Like, just give people a sense of, if you've not done this before but you're curious, what am I getting into?
Yeah. So semaglutide, I mean, we're pretty competitive.
Okay.
I've negotiated with our pharmacy a few times because I see the great things it's doing for people, and I
Yeah.
want them to continue, and I want them to get to their goals. So we offer semaglutide anywhere from $400 to $450 a month, which is pretty good. My favorite thing about like Botox and fillers is when the husbands come in for the gift cards for like Mother's Day, and they're like, I'd like to get my wife some Botox, and I'm like, that's great. Has she been here? And we look up her profile and see how much she gets, and then we say that, and they nearly fall over every time.
Yeah, their head always swings back.
I'll just get $100 gift card.
Yeah.
Okay, that'll do like half of one side of her face.
Like
Right.
just an eye. That's it. I mean, I think what's important to take away from this is you can get Groupons, right?
Yeah.
And you can get discounts, but it's kind of like you get what you spend.
Yeah.
Right? So I think our pricing is pretty competitive. Botox goes by unit. It's different for every person because it's based on muscle strength.
Okay.
So if you have a really strong forehead, typically our men clients need a lot more Botox than our women clients.
Okay.
Women who are more mature need a lot more Botox than our 20-year-olds. So it's not like a cookie cutter thing. But I think that for Botox, you can typically expect to spend $300 to $700 for a face.
Yeah.
And if you start it younger, do you tend to not need as much as you get older, or does it not really matter?
Per appointment, every like 3 to 4 months, if you were to come in and you've never gotten it before and you are later in life, they are going to require a lot more than somebody that had been getting it frequently and staying on top of it at that same age.
If you think of a piece of paper and you fold it and you have a crease, right, and you keep kind of creasing it, it's going to make that line deeper. But if you are frozen, like I'm pretty frozen right now, I was injected last week, like my crease isn't there anymore, so it's going to kind of not get deeper,
Yeah.
if that makes sense.
Right. What can people expect from the experience when they come in? Let's say they want to get an IV.
Yeah.
Is it very medical? Is it very spa? Is it in between?
I think in between, yeah.
Yeah.
I think someone walks in, we still take their medical history, we take their blood pressure to make sure
Okay.
that's in a good range. We sign consents, HIPAA, we know everyone in this neighborhood,
Yeah,
and this is actually
especially
a
here.
really important point, and I say it to everyone. you know, she's in a certain generation, I'm in a certain generation. Together, we pretty much know everyone who walks in here. And so privacy is important. It's the law.
Yeah.
So we make sure to mention that, especially with our weight loss clients, because that can be sensitive for sure. So we sign consents, and then we ask them kind of what's going on today, what brings you in. Oh, I'm hungover, or oh, I'm 4 weeks pregnant and can't keep anything down. And then we advise them on what mix we would suggest for their ailments. And then we hook them up, put an IV in,
Right.
And then they can watch Netflix in a lounge chair. So I think that's like where the spa comes in.
Yeah.
They're really comfy looking chairs.
They're so comfortable.
For sure. And they can bring their friends too, so that kind of looks like a spa as well.
Yeah.
So.
Yeah. We want people to know that we take this all very seriously.
Yeah.
But we also want you to feel comfortable with just a few local girls.
Yeah.
Have
Having
a
a
nice
nice
experience.
relaxation day.
It's not a medical appointment. It's not a doctor's visit.
Exactly.
Yeah.
Last question about this. What is one thing you would tell people who are maybe thinking about it or have some reserves? Any advice?
Yeah. Come in for a consultation. We can answer your questions. We can be thorough. We can go as slow as you want. You don't have to have like the whole gamut of services in one visit. We can do things slowly, and I encourage that.
And if someone wants to come in for a consultation, you won't pressure them to do something that day, right? Like they don't need to feel like if I consult and take their time,
Yeah.
I better get an injection.
No,
Okay.
I think it's better, especially for filler. I think filler is a commitment. I think it's better that you leave the consultation and then schedule something later.
Okay.
After Botox consultations, we generally do inject. But no, I think yeah, come in and see what we have to offer.
Okay. Nice.
Yeah.
Last question. Where is your favorite place to eat in Dorchester?
Oh. I like Molinari's.
Okay. Well,
Yeah.
it's just
right
there,
across the
so-
street. They have gluten-free options for me. I like it there.
Can I have a few answers?
Sure.
So I have 3 kids. I think like a great family establishment is Blasi's right next door.
Okay.
Very family friendly.
Big. Lots of space.
Lots of space. I mean, when my kids were really little, they could run around and like no one would care. If we're going out for like a bite after work, I'd say McGonagall's.
Okay.
Yeah.
New,
A
right?
bite
Yeah.
and a pint.
Yeah.
A bite and a pint. Yeah.
Awesome. Well, thanks so much. I appreciate, again, you letting us invade your space for a few hours. And hopefully people will get something out of this and can ask you questions if they want to come in and avail themselves of your services.
I love that. Thank you so much.
Absolutely. Thank you.
Thank you.